This conference will now be recorded.
Good morning, everyone. Thanks for joining us. This is Melissa Morin. I'm a Public Information Officer for the Whatcom County Health Department. As we get settled, just a reminder to please take a moment and mute your microphone if you haven't already done so. For today's briefing, we're going to hear from Erica Lattenbach, Whatcom County Health Department Director, and Scott McCreary, Incident Commander for Whatcom Unified Command. As a reminder, this meeting is being recorded and it will be available online this afternoon on Whatcom County Government's YouTube channel and also on our media page at www.whatcomcounty.us/COVID. Once we've heard from our speakers, we'll open up the question and answer period. And at that time, we'll invite members of the media to ask questions. And with that, I'm going to turn it over to Erica.
Thanks, Melissa. Thanks for joining us all. We want to talk to you about our testing pilot. As many of you know, we are halfway through a pilot for low barrier drive-through testing. We conducted testing last weekend on Friday and Saturday from 9:30 to 3:30, and we'll do so again this Friday and Saturday. So we're halfway through the pilot. Low barrier, for those of you that don't know this nomenclature, is really a standing order from our health officer, or frankly any MD that allows us to test anyone who arrives, whether they need a test, whether they've been identified as having symptoms or exposure or none of the above, or if they need it for travel or for employment. It allows that provider to be able to have those folks tested rather than getting a referral from their healthcare provider. So standing orders can be used by other healthcare providers as well. And we've had a standing order for months through the health department, where we had a nurse consult that used our doctor's standing order, Dr. Stern, in order to talk about symptoms and exposure and be able to schedule testing for individuals at Northwest Labs. What we did that was significant was expand that standing order to allow for anyone despite symptoms or exposure to be able to be tested. So last weekend we tested about 800 people, and we're prepared to test about 600 people, but the team of staff and volunteers were able to do just really above and beyond what we'd planned. And we're very grateful to the many, many people, both in a volunteer and staff capacity, that joined us over those 2 days. What we found is the test results came back with less than 1% testing positive, which is much lower than the daily positivity rates we've seen in the testing data thus far. And we were able to notify everyone of their results within 48 hours. Northwest Labs has been just an incredible partner in quickly turning around the lab results and allowing us to make calls and send text messages on Sunday and Monday of this week. So we were able to quickly let folks know their status. What we learned from the intake information was those in terms of age demographics, it was pretty even across the age categories from 18 to 65. We did see that 28% of individuals tested were between 18 and 29, which, as we've talked with the media before, has been a target area for new infections. And so glad to see that that age group was well represented in those that were tested. 24% were between the ages of 30 and 49, and 21% were between the ages of 50 and 64. We also found that about 3/4 of the individuals have residence in Bellingham, and other Whatcom County locations were each less than 10% of the total. We also did see about 7% of the total being tested from outside of Whatcom County, which is interesting as well. And anecdotally, and this is anecdotes from other folks who were were at the testing site. And from myself, I worked the registration all day on Friday. So I would say I probably saw a sixth of the 400 people and did intake with them. And what I found and what others found is the lower positivity rate was due to the fact that I would say over 90% of the people that I saw and registered had no symptoms and no known exposure. And people that wanted to be tested in order to travel to other places, or for example, to go home to Alaska. We did see that many people have insurance. A very large percentage of the folks that were tested have insurance and have a regular healthcare provider, but still chose to come to the drive-through site. So this weekend we are exploring other ways to get more information so we can learn more about why people came to the drive-through site versus going to their doctor, so we can continue to work with healthcare providers to remove additional barriers that people are facing in getting tested. Testing is, of course, very important. It's necessary, but not sufficient in this effort to control the disease. There are a lot of options for people to be tested, and in fact, our website, whatcomcounty.us/COVID testing, has more information about testing options and providers. And we want to encourage folks, because we've been doing the drive-through testing on Fridays and Saturdays, we really don't want people to wait until Friday or Saturday if they're experiencing symptoms or if they've been identified as a close contact. They can go to their primary care provider, their primary care doctor, and are able to get tested that way as well. Northwest Labs is also testing individuals with a provider's referral. So there are options other than the drive-through site, and I just want to make sure that that's clear to individuals that may be waiting 3 more days to get tested. If they have symptoms or have a known exposure, they should get tested sooner than that, and they can do so through their doctor or by calling the health department. So with that, I'll turn it over to our incident commander of Whatcom Unified, Scott McCreary.
Thanks very much, Erica. Firstly, let me say thank you, just my deepest thanks to all the volunteers and staff and our other community partners who helped out with the COVID testing this last weekend. We wouldn't have been able to pull it off without all of their help. We manage the personnel associated with this kind of by shifts. So I can tell you that we had 105 shifts filled over those last 2 days, or those 2 days of last weekend. Still trying to work out what that turns out in terms of individuals. Some people volunteered for a single shift. Some people volunteered for 4 shifts. In fact, I just got a text. They're saying we had 65 total people, so 65 individuals who then volunteered to pull this off. But these were folks from our Whatcom County Medical Reserve Corps, so these are licensed medical professionals who volunteered their time, Whatcom County staff members, City of Bellingham staff members, and then other members of the public who came in as volunteers either through Whatcom Unified Command or who are signed up as volunteers for the health department and typically assisting with contact tracing there, but were reassigned to assist with the testing. And a final shout out, I guess, to our volunteer branch within the logistics section here at Whatcom Unified Command. They were the ones that had to pull those 65 individuals together, get them assigned out, reaching out to our list of more than 100 volunteers to then fill all those spots. But they did yeoman's work there. I'd like to thank the City of Bellingham for their partnership in making the Civic Field facility available to us. We really would not have been able to do it the way we did without their assistance. And want to recognize Richard Griffin with the City of Bellingham Parks. He's the site supervisor there and provided us with just excellent site support. As Erica has noted, this was a pilot program. So between debriefs that we did at the end of each day last weekend, and then a full debrief that we conducted earlier this week to take a look at the complete operation over the weekend, we've identified improvements that we can make to our processes to help make things move more smoothly and more quickly. And we're in the process right now of implementing those changes in advance of the coming weekend's testing. Wait times last weekend were sometimes greater than 2 hours for some folks waiting in line, and we appreciate the patience that people showed. I would say that, I was just deeply impressed by the patience and kindness that everybody in line showed to one another and to all of our staff and volunteers. I really can't think of a single instance where somebody, was angry or expressed anything other than gratitude. Certainly a little bit of frustration over the wait, but gratitude that the testing was being made available. So we appreciated everybody's patience with us. We're making some changes to hopefully make that move a little bit faster. But it's important that people understand that even this coming weekend, they should be prepared to wait if they choose to use this drive-through site. It is not unlikely that at times the wait will be 2 hours or greater again. And that's just by virtue of the space and staffing limitations that we have that during the pilot limit us to running 2 lines of vehicles through registration and testing at a time. Given the timing of the testing, we start testing at 9:30 and go until 3:30, and given that there can be a 2-hour wait, people should know that if you arrive after 1:30 in the afternoon, it's possible that you would not be able to be tested. So that's just something that people should be aware of. I will say, though, that we are providing real-time updates on what the wait time is. Those are posted out through the Whatcom County Health Department and the Whatcom Unified Command Facebook pages, so people can monitor Facebook and see what the wait time is. And we would certainly encourage them to do that and manage their time accordingly. We accommodate not only drive-through traffic, but we can accommodate a limited number of walk-up and bike-up testing for folks. That is not the focus of this pilot. We have made accommodation for it, but people should know that that is a limited capacity that we have for that. And really what we're geared toward is the drive-through testing. For those folks that may come in by foot or by bike, just encourage them to be sure to take appropriate personal precautions. They need to be wearing a mask. They need to maintain the 6-foot social distancing while they're waiting in line for testing. Wasn't really a problem last week. We were able to manage that, but people should be cognizant of that and keep that in mind. One of the things that will be different this coming weekend is the way that we're managing traffic across the whole weekend. Last Friday's testing was occurring on the east side of the Civic Field parking lot because we were using the west side of the Civic Field parking lot for the food distribution that has been occurring there every Friday in conjunction with the food bank since early on in this COVID response. We've been able to coordinate with them, and we're actually moving that activity onto Orleans Street on the side of Joe Martin Field, and that will make all of the parking lot available to us both Friday and Saturday of this coming weekend. So we will be able to better manage traffic using that whole parking lot as we did this past Saturday. That pulls that traffic off of Puget Street and minimizes impact to the local neighborhood traffic there, as well as the through traffic that we see on Puget. But we have committed to the city through our traffic management plan that we will not back vehicles up onto Fraser Street. They specifically asked us to manage to that, and we are committed to doing so. So if we do find that we're not able to accommodate all the vehicles that are in line within the parking lot at Civic Field and on Puget Street, all the way back to Fraser, including using the Jerry Field parking areas, we'll loop cars through there if needed. There is always the potential that we could have to turn some cars away and ask them to just come back later in the day when there are fewer vehicles in line. After this weekend's testing, we'll be doing another debrief, and we will take the lessons learned from this weekend's activities and incorporate that into conversation about what testing might look like going forward. There won't be any final decisions made about the future testing until we've finished out this pilot and our assessment is completed sometime next week. And I think that's it in terms of background.
Thank you, Scott and Erica. We're going to go ahead and open up a question and answer period. Again, we'll invite members of the media. If you'd like to ask a question, we've opened up the chat feature. Go ahead and type in your name and affiliation, and we'll call on you to ask your question. Our first question is from Key Relia with the Bellingham Herald. Key, go ahead.
Hi, thank you. Just a point of clarification. Erica, when we did a quick interview on Friday and also in an email that I received from the WAC, my understanding was that the total testing that you had anticipated or were prepared for, well, no, I shouldn't say that. You said that you weren't sure about how many people will get tested, and you thought that you could test up to 300 people. And I just want to make sure that that was your original intent. I know the news release yesterday said 600. So I just want to make sure that I'm clear on the numbers. Were you talking about 300 a day, or were you, did you get a lot more people than you expected? Thank you.
Yeah, sure. So we were planning on the upside of 300 a day. There were clearly nearly 400 a day, and we were able to make some adjustments that resulted in further efficiencies. We were able to move the traffic along faster than we had anticipated because our model sort of anticipated a certain wait time and a certain number of minutes between registration and completion of the test, and we were able to expedite that slightly. So it resulted in us being able to accommodate more people than we had anticipated. So, we don't know what to expect this weekend, and because this is a pilot, we're prepared for high numbers again, and we'll continue to refine the systems to make them more efficient, so we can hopefully see everyone that comes to Puget Street.
Our next question is from David Rossbach with the Bellingham Herald. Dave, go ahead.
Hello. You mentioned, Erica, that about 73 or about 3/4 of the people that were tested were from Bellingham. Mm-hmm. Are there discussions to have similar tests like this elsewhere in the county so that maybe you see more representation from those folks as well?
Excuse me. There are always discussions, but at this point, we're really just in the pilot, trying to assess what the needs are, how we can do this efficiently. And I think it's just important to note that the health department and Whatcom Unified are not the only routes for providing testing. This is a community response, and we're also trying to work with our healthcare providers in different parts of the county to increase testing, to remove barriers, to have different options for people that live in those areas. So this is a community-wide response. We recognize that we need to make sure that there's access throughout the county, but I think there's multiple different ways that we can achieve that.
Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Thanks, Melissa, Erica, and Scott. I realized this was mostly about testing, but the other half of that is contact tracing, and I was curious if you could update us a little bit on how that is going.
Sure. Yes, we continue to manage the case and contact investigations internally within the health department. We saw during the surge a high number of cases and a high number of associated contacts with each of those cases, which made us reach out for partnership to state government to help with some of the surge capacity that we needed. We are back to a point where we are managing all of the cases and contacts internally and have transitioned some of our internal software systems in order to be more efficient and to streamline the process. So we continue to do that work and are able to accommodate all of that internally at this point once again.
Oh, that's great. Thank you very much.
Mm-hmm.
We'll go ahead and keep this open for just a moment longer and see if there's any other questions.
Well, while we're holding that, I just want to mention that even though we are learning through the process with this pilot, and we did identify some lessons learned and some additional efficiencies, the process for individuals will remain the same. It's still going to be from 9:30 to 3:30 on Friday and Saturday. There still will be no appointment required or registration needed. We will still ask people to bring their insurance ID and their photo ID and be prepared to wait in line. And we still are very hopeful that we'll be able to let people know their positive or negative status within 72 hours. So all of the sort of the things that we were sharing with individuals last weekend will apply for this weekend as well.
And if I can just add on to that, Erica, two items that I think we recognized while we were trying to manage traffic in the line. There are no public restrooms available there at Civic Field, available to the folks in line. Part of that is trying to keep people in their vehicles. So people should come prepared for that, but also encourage folks not to bring pets with them. You know, it's a long time in the car for pets. Last Friday in particular was a pretty warm day. And we are asking people to keep their windows up, again, just for infection control purposes. So, you know, it creates a challenge for folks that are there in line for multiple hours with pets in a vehicle that has to be kept closed. So would certainly encourage and remind folks of those two things.
Thanks, Scott and Erica. Looks like we have another question from David Rasbach with the Bellingham Herald. David, go ahead.
Hi, I was wondering if you could tell me a little bit about what the cost of the pilot program is in terms of dollars and cents.
Yeah, sure. So we're working through that currently, and we'll know more after this coming weekend. Scott and I are prepared to both address the County Council/Health Board next Tuesday when they meet to talk through more detail about what we learned in the pilot, what the costs associated with it were, et cetera. So we'll have more of that information next week after the completion of the pilot.
All right, it looks like that is all the questions, so we'll go ahead and close this out. Thank you everyone for attending.